Hi friends. I'm Dr. Shaiil Gupta. Again, I'm on Hair channel. Sorry, we streamed this on by mistake on the Skin channel. So just to remind you, we have a Skin channel as well where we post a lot of skin-related videos. And but this live stream was meant to be live from the Hair channel. So we just interrupted it, and now we are back on the Hair channel. And sorry for the interruption and sorry for the delay. Yeah. So the topic for today's discussion is FUT versus FUE. As we know, people who are interested in hair transplant, they are doing their research, and sometimes people don't even think about the technique because they take it for granted that almost 18, 20, 50 or 100 of the clinics are telling one particular technique, so they should go for that technique only. Now, I would like to emphasize here that both the techniques are good, both have their pros and cons, and one has to be very careful while choosing the technique, because if you don't pay attention to this, you are going to be in trouble. Okay, so the most important and foremost thing which is so important is number of grafts. So when you are doing a transplant, especially in high grade patients, you need maximum number of grafts. And if we do only one technique, that's FUE, then we cannot get that many grafts. While if we do FUT, or combination of both the surgeries, I call it MHT, maximum harvest technique. So if we do a combo of the techniques, then we get a good number of grafts. So many a times you will see people traveling distances and coming for surgeries. They get one FUE done, then again they come after 6 months, 1 year for second FUE. And although they didn't know, because they did not reach the right place, because they did not connect to the right clinic or to the right doctor, uh, the entire procedure could have been done in just one session itself, in by including FUT and FUE combination. Okay, you understand this. But in case somebody opts for only one method, then that's a big problem, because you cannot take so many FUE grafts from that area. And secondly, if you are doing a repeat FUE, hi Pavan, namaskar, Rishi, hello, Anand, hello, hi. uh, पवन, आप कांटेक्ट नंबर है 9999 570494, उस पर बात करिएगा. अ, अच्छा, अब हम बात करते हैं वापस से जो टेक्निक के बारे में. सो सी, द इम्पोर्टेंट थिंग इज व्हेन यू आर डूइंग व्हेन यू आर डूइंग योर रिसर्च, you should pay attention to these basic facts. The number of grafts, it is very very important. Now, suppose if you do a second surgery or you do a third surgery, and you try to extract all the hair which are present in that FUE, the safe donor zone. You cannot take out all the grafts from safe donor zone if you are extracting by only FUE. While when we cut a strip, we get the entire number of grafts in one shot, 3000 or maybe 4000, or whatever the strip size is and the density depending upon that particular portion. So, Anand, I never took finasteride, but I took dutasteride for 6 months, but I got side effects. So it means I will get side effects with finasteride as well. Anand has asked, he has never taken finasteride, and he was straight away put on dutasteride for 6 months. And I will he get side effects if he starts finasteride, because he got side effects with dutasteride. So see, both are DHT blockers, finasteride and dutasteride. Dutasteride is a stronger congener of finasteride, and it has more side effect potential and more benefit potential as well. So if you, I don't know why you started taking dutasteride in the beginning itself. In my entire career of 20 years, I have given dutasteride to just 3 or 4 patients, not more than that, because we don't need to start dutasteride in these cases. When do we need to start dutasteride? We need to start dutasteride when a patient has developed tolerance to finasteride. So finasteride is uh, being overused these days. A lot of people, I keep talking about this, a lot of people use finasteride uh, after transplant. Almost all the cases which you see on internet, they are put on finasteride post transplant 1 mg per day. Now there are two issues with these medicines, minoxidil, finasteride, or to some extent procapil and other medicines also, but majorly I am talking about minoxidil and finasteride. The two issues are dependence and tolerance. That means when you take the medicine, you cannot stop these medicines because your body becomes dependent on that. So many a times when you start the treatment and you are put on minoxidil finasteride, telling you that you need to take it for 6 months or 10 months and afterwards we will slow it down or maybe completely stop it, that's not possible. That will not happen because this medicine cannot be stopped. Tapering is not a good idea. It's a better idea to start medicines at lower dosage. So, what happens? A lot of people who get only FUE surgery done, uh, all these patients, whatever number are claimed, 4,000, 5,000, 6,000, I think more or less it is a bluff. And all these patients, it is a compulsion for doctor to start finasteride immediately after transplant to hide the problems or incompetence of the procedure. Okay, so if you start finasteride immediately after transplant, it will improve density, it will improve coverage, it will improve the aesthetics of hairline, which is very beneficial for the doctor. But shall you start the medicine immediately after the surgery, or shall you wait for some time, maybe in case you when you actually need it, because initial time you can buy with minoxidil alone also. So these things are important. But yes, if you are going for only FUE, whatever numbers are claimed, uh, a lot of work will have to be left on, will be left on finastride's shoulders, and then finastride will come into picture. Okay, so that's very important. After doing FUT, when can I go office, sir? How much day I should take leave from office? See, in case we are doing only FUT, you can, uh, it can be done in some cases, it can be done even without shaving off the head. And there is an option of long hair transplant in FUT, which is not there in FUE. So that means long hair are extracted from back of your head and they are straight away implanted in the recipient area. But obviously they will also enter shedding phase, and then shedding phase will occur. But yes, long hair transplant is also one of the options. And because we don't really need to shave off the donor in case of FUT, many a times we can do surgeries without shaving off the head if other conditions are conducive. So this is the number which is reflecting on the chat. The any problem you have, you can leave a message or call us. My team will contact you. Sometimes there are so many queries, so many questions, and we don't rush up things. We try to clear all your doubts, so it sometimes it takes time. So please be patient, and obviously we are here to help you. ज्योति सर, मेरे क्राउन से हेयर फॉल हो रहा है या जेनेटिक है? आई एम अ बॉय. ओके. ज्योति, yeah, you must have difficult time to explain this, and that's why sorry I laughed, but you have mentioned I'm a boy, so many people who have this kind of name, they face this trouble. So crown से genetic भी हो सकता है. There are people who have thinning in crown because यहाँ पर frontal hairline maintained रहता है और crown में पीछे की तरफ बाल कम हो जाता है कुछ लोगों का. तो this is a pattern which is sometimes seen in some patients. So पवन, आप हमारे टीम को कांटेक्ट कर सकते हैं. माय टीम विल शेयर ऑल द डिटेल्स, ट्रांसप्लांट कॉस्ट एंड एवरीथिंग. Anand, what do you think about oral minoxidil? See, oral minoxidil is also an option which can help people. I mean, um, it can be used in patients who are not responding to topical minoxidil or have developed kind of tolerance with this. As we know, minoxidil is an antihypertensive medicine which was initially used as injectables, IV, and it can be used orally also. Uh, yes, but there is not a huge data of oral minoxidil. It is not preferred worldwide to that extent. I mean, to which extent we use topical minoxidil. सर हम पीआरपी कब तक हेयर को बचा सकते हैं? मीन हाउ मच पर ईयर? सी ज्योति, जो ट्रीटमेंट होते हैं लाइक for what you call PRP. PRP is a good treatment, it can help, but the thing is PRP आप जब करते हैं ज़रूरी नहीं है कि आपको उसको बहुत जल्दी-जल्दी रिपीट करना चाहिए। इसमें भी सेम प्रॉब्लम होता है, डिपेंडेंस एंड टॉलरेंस। So when you start the medicine, you will find that I mean when we do PRP, you will get benefits maybe just within 2 months of the treatment. But if we repeat it too often, patient can develop tolerance. So PRP का रिजल्ट अगर आपको लंबा चलाना है तो आपकी कोशिश ये रहनी चाहिए कि जितना गैप ज़्यादा से ज़्यादा हो। People who go for 4, 5, 6, 10 sessions in a go at a stretch, that's not good, and that really hits your chances of uh, retaining your results with PRP, long-term chances, because it will induce tolerance. Uh, Anand Sharma, if you don't give finasteride to patients, so how can we save existing hair? See, it's a good question, Anand, which you are asking. If I'm doing 100 transplants, suppose all the 100 patients won't be needing finasteride. That's for sure. I cannot pre-decide that I have to give finasteride to each one of you. Each one of you are different. You have a different pattern of loss, different past treatment record history, different genes, different genetic family history. Okay, different patterns of baldness, different grades of baldness, different age group. So if I'm doing transplant for 100, not 100 patient need finasteride. Okay, and secondly, if we have to add finasteride, then there are two questions. One, at what timing should it be introduced? Immediately after transplant? Is it compulsory to start this medicine immediately after transplant, or can we wait for some time? Or secondly, at what dosage? Do we really need 1 mg per day dosage in all the patients? So these are very important two questions. Now what happens when you are getting a surgery done? You are anxious, the doctor is more anxious than you, doctor is under more pressure to show you the results. And if the doctor has over promised the number of grafts, or if the doctor is showing you results which actually were contributed by and large by finasteride, you sometimes never know. Finasteride can be the lead actor and actual transplant can be just in supportive role. Finasteride can do wonders to that extent. It is like oral topic, the hair fiber which you put on scalp to camouflage baldness. This is finasteride is an oral topic. Okay, so when clinics or doctors are consistently showing those cases which where finasteride has been given, now you expect the same kind of density and coverage. You know, finasteride works on three aspects of your hair transplant results. It will improve the coverage in the areas where no transplant, no graft has been put. You will see that the hair growth has significantly improved. Secondly, the density in those areas where transplant has been done, but there are miniaturized hair present in that area, you will see increase in the thickness of miniaturized hair contributing to increase in density. And thirdly, the hairline aesthetics. Now if you see my case, I have done my transplant around 10 months back. So if you see this hairline, uh, this is, I am not on minoxidil, I am not on finasteride, and still I have a very good aesthetic hairline and which is pretty dense and there is no gap and nothing. So not every patient needs finasteride. I myself am not taking finasteride, but if you suppose had I taken finasteride, it would have further improved the density throughout the scalp. Now, as a patient, is your goal just to improve the density for, and do you know how long is it going to work? It may not work for forever. You know, there are tolerance issues with finasteride. If you start with 1 mg dose per day, do you really think you'll be able to sustain this? You'll keep taking this for another 3, 5, 6, 10 years down the line? Do you really think you'll be able to take? What will happen when you stop this? All these hair will fall. Patients come to us, uh, they say, doctor, we had transplants, we had good results, we were quite happy with the results, but after 1 year we can see there are a lot of gaps even in the transplanted area, and the back area and everything is like kind of empty. So these patients were told that you take finasteride for 1 year, maybe then we will see, we will reconsider. See, don't fall prey to such tactics. If you start it, finasteride is a marriage from where there is no option to take divorce. You cannot divorce finasteride. Your hair will fall, and in a very, very severe manner. So, second issue, at what time? So, if the doctor wants to take the credit of this finasteride also, okay, so then they will start it from day one. In some patients, we do need to start the medicine from day one. I also do that in many patients, but not in every patient. Secondly, in some patients, because we are giving minoxidil, patient has not used minoxidil earlier, we can buy some separate time through minoxidil also. Why do we combine the two and cut down the time? We really don't need to do that. जरूरत नहीं है हमें इतना सारी चीजों की एक साथ करने की. ये जो फिनेस्ट्राइड आप खा रहे हो, जो आपको दी जा रही है, इसकी जरूरत हो सकता है कि आपसे ज्यादा आपके क्लिनिक को हो, क्योंकि आप तो जा रहे हैं वही रिजल्ट देख के, जिनमें फिनेस्ट्राइड खाई हुई है वही रिजल्ट दिखाए जा रहे हैं आपको. आपको लगता है कि आपका भी वो चमत्कार हो जाएगा. आपके उतने ना तो ग्राफ्ट किए जा रहे हैं एक्चुअली में, और ना आपको और ऑब्वियसली आप अगर फिनेस्ट्राइड नहीं खा रहे हैं, तो फिर तो आपका वो बाल तो दिखेगा नहीं वहां पर. तो आप तो डॉक्टर से पूछेंगे, जी आपके फलाने पेशेंट में इतने बाल हैं उगे हुए, हमारे तो उगे नहीं इतने, क्या चक्कर है? So a lot of reputation and everything is at stake. But what do you need to do with the reputation of clinic or some, doctor? You have to think about yourself. Apna dekho na aap, how long can you sustain the results? Even if you are ready to take finasteride for next 10 years, do you really think finasteride will keep working for next 10 years on your scalp? It may not keep working for next 10 years. You understand this? तो ये चीज़ भी मैं आपको बताना चाह रहा हूँ. हाँ, फ़ारूक, यही हम बोल रहे थे कि आप जब फिनेस्ट्राइड खाते हैं, तो ज़रूरी नहीं है कि आपको वो हमेशा के लिए रिज़ल्ट्स देती रहेगी. 3500 हेयर में कितना एरिया कवर होता है? Well, it depends on the number of the multigrafts which you have. कितना एरिया आपका मल्टीग्राफ्ट्स कैसे हैं वहाँ पे, मिनिचराइज हेयर की स्थिति क्या है, जो एग्जिस्टिंग हेयर है वहाँ पर वो कैसे हैं, और क्या हम दवा यूज़ कर रहे हैं. फॉर एग्जांपल, अभी हम फिनेस्टाइड की बात कर रहे थे, तो चले कर ही लेते हैं. कई ऐसे पेशेंट्स होते हैं जिनमें बहुत सारे मिनिचराइज हेयर होते हैं, और वहाँ पर भी आप देखेंगे बहुत बड़े नंबर्स आपको बता दिए जाते हैं, 3500, 4000 ग्राफ्ट्स, और पेशेंट को फिनेस्टाइड पे डाल दिया जाता है. तो अगर आप देखें, हो सकता है 3500 छोड़े, आपको वहाँ पर 350, 350 ग्राफ्ट्स में भी आपको लगे कि यार ये तो भर गया, क्योंकि फिनेस्टाइड खाया. तो फिनेस्टाइड एक जादू का दवा है, और फिनेस्टाइड आपको देखना है, संभलना है, और अपने सभी जो जो भी आप क्लिनिक पे जाते हैं, पूछें पहले फिनेस्टाइड. कोई बोलते हैं आपको खानी है 1 mg फिनेस्टाइड, तो आप कहो कि मैं तो 6 महीने बाद आऊँगा ट्रांसप्लांट कराने, पहले खा ही लेता हूँ. तो हो सकता है आपको 3500 ग्राफ्ट्स की ज़रूरत ही ना पड़े. सिमरन, यू कैन यूज़ Satya's शैम्पू ऑल्सो. आपने पीआरपी कराया हमारे क्लिनिक से. वी हैव अ गुड शैम्पू बाय नेम ऑफ Satya's शैम्पू, दैट्स एसएलएस पैराबेन फ्री कैफीन बेस्ड शैम्पू, that you can use. That's a good shampoo. Shantanu Jaiswal, do you give dutasteride to your patients? No, I don't give dutasteride. I have seen this. See, again, please pay attention to this. I'm again telling. When finasteride is overused, when finasteride stops working, patients are put on dutasteride. And because it is introduced way too early, finasteride, and sometimes I've seen people directly starting dutasteride without even going for finasteride or low dosage. So please, the time of introduction of medicine and the dosage of medicine are so important, so important. You are probably you know क्या बोलूँ, आप शायद किसी क्लिनिक के बहुत बड़े एम्बिशंस का शिकार तो नहीं हो रहे हैं। आप कहीं शिकार तो नहीं हो रहे हैं लोगों के एम्बिशंस का। आपके कहीं लॉन्ग टर्म इंटरेस्ट कॉम्प्रोमाइज़ तो नहीं हो रहे हैं। किसी क्लिनिक की दीवार पे टंगने के लिए नहीं हो आप। यू आर अ लाइव ह्यूमन बीइंग विद इमोशंस, विद एक्सपेक्टेशंस। आप शायद चाहेंगे कि आपके रिज़ल्ट्स ज़्यादा से ज़्यादा लंबे समय तक स्टे करें। और ये जो एफयूटी और एफयूई की डिबेट रहती है, इसमें भी यही परेशानी है। आपके पास लिमिटेड डोनर है, अपना दिमाग इस्तेमाल करो। उस डोनर का इस्तेमाल करने के लिए जब आप अगर सिर्फ़ एफयूई इतना पोर्शन आपका सपोज़ सेफ डोनर ज़ोन है, तो क्या आप इस पोर्शन में से सारे बाल एफयूई से निकाल सकते हो? कैन यू टेक आउट ऑल द ग्राफ्ट्स बाय एफयूई अलोन फ्रॉम दिस एरिया, सेफ डोनर ज़ोन? यू कैन नॉट डू दैट। करोगे तो क्या होगा? ये सारा पोर्शन खाली हो जाएगा। अगर पर क्या मैं एफयूटी करके ये सारे पोर्शन के वाल इस्तेमाल कर सकता हूँ? येस, आई कैन डू दैट। मैं एक स्ट्रिप निकालूँगा, एरिया इतना रह जाएगा, आई एंड अप हैविंग अ थिन लाइन। दूसरी स्ट्रिप निकाल सकता हूँ, एरिया इतना रह जाएगा। तीसरी स्ट्रिप निकाल सकता हूँ, आई कैन यूज़ दिस एंटायर एरिया बाय एफयूटी अलोन, जितने भी ग्राफ्ट्स यहाँ थे। पर अगर मैं एफयूई करता हूँ तो मैं नहीं कर सकता। इट इज़ एज़ सिंपल एज़ दैट। एफयूटी कोई पुराना टेक्नीक नहीं है, मैंने खुद अपना एफयूई किया है, क्योंकि मेरे केस टू केस इट डिफर्स, है ना? प्लीज़ यूज़ योर ब्रेन। आप किसी क्लिनिक की लिमिटेशन की उनको नहीं आता ये करना, वो नहीं कंफर्टेबल है उसे करने में। आप व्हाई शुड अ पेशेंट पे फॉर दैट? And then patient pays not only through by choosing wrong techniques, but patient also pays through his health by taking inappropriate medicines at wrong timings. बिकॉज़ ज़रूरी नहीं है कि आपको 1 एमजी फिनेस्टाइड हर पेशेंट को खिलाना ही ज़रूरी है। हज़ारों पेशेंट्स हैं मेरे जिनको हमने नहीं दिया, उनके बाल अभी भी ठीक चल रहे हैं। कनिष्का राठौर मिनॉक्सिडिल को स्टार्ट करके बंद कर सकते हैं, नहीं कर सकते हैं। मेल पैटर्न पैटर्न बाल्डनेस में नहीं कर सकते हैं आप, करेंगे तो रिबाउंड होगा, डिपेंडेंस होती है। फीमेल्स में कई बार अगर बहुत ज़्यादा फ़ायदा नहीं हुआ है तो आप बंद कर सकते हैं, और अगर आपने बहुत कम समय यूज़ किया, महीना, डेढ़ महीना, आप बंद कर सकते हैं, पर आपने 3 महीना, 4 महीना यूज़ कर लिया, देन यू कैन नॉट स्टॉप। So again, the numbers are reflecting in between. You can see this is our number 9999570494. आप जा सकते हैं। अच्छा, एक और, see we have a website by name of hairtransplantindia.co.in, hairtransplantindia.co.in। तो थोड़ा-सा अभी उसमें काम चल रहा है, like some work in progress. Very soon, within a week's time, when you go to the gallery of this website, hairtransplantindia.co.in, all your doubts will be cleared. And this would be a landmark gallery which will like clear everything. आपको कुछ और देखने की ज़रूरत नहीं है। आप जाओ गैलरी में, देखो, वहाँ पे सब लिखा है कि किस पेशेंट का, अभी नहीं, आज नहीं, 1 हफ्ता का टाइम देना। सब लिखा मिलेगा। आप रिलेट कर सकेंगे किस पेशेंट को क्या ट्रीटमेंट दिया गया, कितना दिया गया, क्यों दिया गया, आपका ग्रेड ऑफ बाल्डनेस क्या था, उनका ग्रेड ऑफ बाल्डनेस से मैच करा के आप देख सकते हैं, डोनर को देख सकते हैं, बहुत सारी चीज़ें। सो I would really urge you to visit our website www.hairtransplantindia.co.in. It's a it's a like huge effort, but yes, we have done this. और आप जब साइट पे जाएँगे, गैलरी पेज विज़िट करेंगे तो आपको बहुत सारी चीज़ें मिलेंगी। बिकॉज़ see, you don't know sometimes the story behind that transplant. You see results, you see before after, you see maybe video, you see combing, whatever, but that may not be real transplant. You don't know about that. You need to understand this fact, otherwise you will repent later on, like thousands of people who are there, millions of people, I guess, who have done it wrong. Even if you get one transplant right, it does not mean See, you have to see at what cost is it coming. I'm not talking about money. I'm talking about the cost of your donor. Do you know when the cost which you pay through your health by taking inappropriate medicines at wrong timings and wrong dosage? You should be wary of that. And secondly, do you know, if you are getting same number of grafts by FUT and FUE, suppose 3000, do you get the same number of hair in that? What do you think? Suppose if you take we take out 3000 by FUT, we don't have leverage to choose multi-grafts. So whatever is coming in the strip will come. So that means maybe the multiplication is around 1.5. So that means we get close to 4500 here. When I'm doing FUE 3000, I have liberty to choose multi-grafts. So that means uh, the multiplication would be higher, maybe 2, maybe 2.5, depending upon the number of multigrafts a person has. So that means if I'm doing FUE, I'm getting 3000 into 2.5. That means 7500 here. So can you compare the result of 4500 here with 7500 here? Please keep it in mind. जो जब आप सिर्फ FUE का रिजल्ट देख रहे हो तो उस पेशेंट के ज़्यादा बाल लगे हुए हैं वहाँ पर। तो चलिए हम ज़्यादा बाल लगे हुए हैं तो व्हाई नॉट गेट मोर हेयर बाय गेटिंग FUE। ज़्यादा बाल लगे हैं तो किस कीमत पे लगे हैं? डोनर की कीमत पे। जिसका FUT किया गया है उसके डोनर में अभी भी वो मल्टीग्राफ्ट पीछे हैं। वी कैन टेक इट व्हेन नीडेड। बट जिस बंदे ने करा लिया है उस FUE, उसका पीछे से मल्टीग्राफ्ट नहीं है। You understand this? This is your donor reserve which you are using or maybe overusing or whatever. So one has to be very careful. Since we cannot get a big number of grafts by FUE alone, I don't know what's happening. People, I mean, come on, it's simple mathematics. Why are you getting befooled? Why? I don't understand this. See, we know FUE cannot give you that many grafts. We know will have to go to unsafe donor zone. We know we'll have to over extract. We know still there are many grafts left after one FUE surgery, and you are doing again FUE and diminishing the donor area, destroying the donor area. Does it make any sense? You have to go for FUT in that portion. So the I think correct assessment is very important. People have been brainwashed with a lot of stuff because every other person is talking nonsense about this, and they don't know. So people develop a kind of perception, okay, and then they just uh, think that so many people are telling this thing, so this must be true. Somebody asked Hitler, German people are good and knowledgeable, and how do you manage to overpower their freedom to think? Why do they follow your instructions? Hitler told that I just keep repeating the same lie again and again, again and again, again and again, and people think that that's true. So if hundreds or thousands of people are telling you lies, you'll think that that's true, and that's the problem. Uh, okay. Why most clinics don't mention about finasteride when showing results? Now, see, the fact is, poor patients, they they just they are so simple, and they trust the doctor, but the thing is, uh, and they give the credit to doctor for the entire thing which finasteride is doing. And many a times after 1 year also, when they stop finasteride, and when they come to know about the gaps, and they blame themselves that we are the ones who stopped the medicine, doctor told not to stop. And but see, actually transplants here were put at these gaps. Whatever grew in between was the gift of finasteride. That was because of finasteride. Patient thought that grafts have been placed very nicely and it's a very good soft hairline. No, it is not. Finasteride is contributing to a major chunk. So that is the compulsion, मजबूरी है डॉक्टर की आपको finasteride खिलाना, बहुत सारे डॉक्टर्स की, क्योंकि काम, अगर मैं आपको बिना finasteride के भी रिजल्ट्स दे सकता हूँ तो मैं किसी काम की के ऊपर दे सकता हूँ, क्योंकि वो एक्चुअल में वास्तविकता में किया गया काम है ना? So, Ker, now coming to next question, I have a good donor area and sure I will go for hair transplant next year. So how can I take care of my donor area right now? Take a healthy diet, that's very important. uh, be positive about your hair. Don't just keep cursing your hair, or hair loss for all the problems which you face in life. That really helps. Have gratitude towards the food you are eating for improving your hair. There are so many things which you can do. Medications are also important, we can do that. But yes, medicine is also a time bomb. It comes with a shelf life. So at what time shall you should we introduce it, and at what dosage? That's very important. And that only an honest surgeon who really think about you. Because see, there are two types of approaches: one, patient centric approach, and the other is doctor centric, clinic centric approach. If you see clinic centric approach, then that's a problem, and you will be cheated. And if it is patient centric approach, you will get the perfect solution for whatever. And see, if I'm taking risk of not giving you medicine, I believe that we can handle things without it also. Let's give a shot. Not everyone needs it. At least we should try. But and this where does this belief come from? This belief comes from the hard work which we are doing with you, the actual work, the actual numbers. So if you find Satya's case without finasteride, with less number of grafts, and maybe FUT as compared to FU in other, so that speaks volumes for the results and for the hard work which has gone in that case, and with a very positive intent to help the patient. I think these things are so important, so important, so important, and people should pay attention towards this. Utsav, yeah, the number is here. Utsav, you can call for appointment. The number is 9999570494. There'll be a form attached to our website. Now, all the people who want to contact us, at least I think you should get a can honest opinion about the management, how to how to sustain your results as long as possible, and what is the correct method or technique, and how can you maximize the donor usage. All these things are important. So we will attach a contact form with our website, and we will add it in all the description, so you can straight away go and fill the contact form. And um, yeah, Risan Biswas, yes, we give online consultations. Please fill the contact form, and my team will contact you. We'll do. What is MHT technique? See, Rohit, MHT technique is maximum harvest technique. That's a combination of FUT, FUE, or maybe sometimes body hair also, which we have to use. Now, when we are combining, we first of all, the doctor has to know the skill of FUT and FUE. So all that shit which you hear people saying FUT is old, बैड आउटडेटेड टेक्निक, बाबा आदम के ज़माने की टेक्निक है, इतना बड़ा स्कार आ जाएगा, ये सब खराब हो जाएगा, वो हो जाएगा, हम तो लेटेस्ट ये करेंगे। और 50 तरीके के नाम आप सुनोगे इन टेक्निक्स के, जहाँ पर आपको बताएंगे अरे ये देखो, ये परफेक्ट सी, ये परफेक्ट वी, ये परफेक्ट डी, ये बेस्ट है, ये वर्स्ट है, ये बिग है, ये स्मॉल है, ये DHT है, ये DHF है, ये DHC है, ये DHM है। All that is shit. So basically what happens, uh, first of all, the knowledge of both the techniques and confidence and skill. Second, uh, where and what to use, which places we use FUE, which place we use beard, which place we use FUT grafts, single graft, multi graft, that mixing, placement, mix and match. So all this is you can compare this to a painter who has a canvas, empty canvas, and different types of colors, and then he paints his imagination over the canvas. And transplant surgery is like that only. Okay, it is like an artist painting on canvas. Can we use Johnson and Johnson's baby shampoo? Khurshid, Every question is relevant. I can understand your concerns. Yes, you can. But yes, we have a shampoo which we have made, which is much better than that. Maybe you can try that one. What is good for grade 2 baldness? It is not much visible. क्या मैं रुकूं और सर्जरी कुछ टाइम बाद बेटर रहेगी? मुझे करीब 2,500 का डोनर काफ़ी अच्छा है. अक्षय आमटे, सी इफ यू हैव ग्रेड 2 baldness, आई डोंट थिंक आपको 2500 ग्राफ्ट्स की जरूरत होगा. यू शुड गो फॉर लेस नंबर ऑफ ग्राफ्ट्स. मे बी दीज ग्राफ्ट्स आर बीइंग ओवर promised, and this is a consistent finding because a lot of people come to me for repair hair transplants. And what I see, for a small area, very small area where I'm doing just 1200 grafts, that too without finasteride, people are being done 2500, 26, and that too FUE, and with finasteride. I don't think this makes sense. I think you should get your assessment done from an honest clinic, honest doctor, capable doctor, a complete surgeon, and a complete clinic with knowledge of all the techniques. Uh, so, in what case hair transplant can fail? What is the success rate, sir? Hair transplant failure means when reality don't meet expectations. You have expectations at this level, reality at this level. So this can be there can be flaws in the procedure technique, uh, or else you have chosen a wrong technique itself. See, for example, if one person has got an FUE surgery done, suppose once, and he has got maybe whatever bad result, and he's again trying to get a result. Suppose even if the result apparently looks good, even on, I mean, on finasteride, especially on finasteride. Okay. But what has happened to the donor? Donor has been exhausted completely. So that is again a failure only. But you will find people, agents, marketing clinics on internet, with all sort of gimmicks, and but that's not true. Please don't fall prey to all these things. There are Tejinder Rana, there are so many names which people have given to their techniques, uh, claiming that this is a very new technique, different technique which we are doing. This is different from ordinary FUE, and many a times people put different price tags for that. If we are doing this specific version of FUE, which is our version, which we have devised, which is something which is amazing, which is different from the entire world, and no other person could think of this. So this is something, a very premium product which we are selling here. If you get FUE done, you pay this much, less pay less. If you are getting FUT, this perfect technique or whatever technique, you pay more. So I think this is unethical because the poor chap does not have money to pay. You will do a very inferior technique which is FUE. You won't do the best and the perfect technique for the patient. You will do such an inferior technique, because if your best technique, if your the modified version is so advanced that it is causing so much of difference from ordinary FU, that means ordinary FU people are suffering. They are suffering. So all this is nonsense. All these people should be awarded Nobel Prize. Okay, and I think, yeah, a lot of Nobel prizes will be given to every gully nukkad in India, and maybe elsewhere also. I don't know, but yes, in India we will get every gully nukkad nai ki dukan also getting a Nobel Prize because of all these innovations. I don't know. Please be aware of these marketing things. I don't think I might sound little blunt, but you know, I'm speaking truth. Uh, we have a lot of uh, hotels, budget hotels, five-star hotels near our facility. So people can easily stay. We can make arrangements for people outstation patients. I'm 19 years, facing hair fall. Please contact our team. Grade 3 hair loss, temples. Ajit, we have to see your case. Please send your pictures on the contact form. Rohit Sahu, every season is good for hair transplant, but we have to see whether the candidate is appropriate for the hair transplant or not. A woman who wants to enhance her hair density should go for hair transplant or PRP. Well, Chaku, it depends on the area of concern. So if you are concerned about the area where you don't have any hair, and it is like you want to extend the hairline slightly below, then obviously transplant is an option. Then if you PRP won't help, but yes, if you are just interested in improving the density in between, then maybe PRP can help you. So one can go for one session of PRP. If it helps, it will help in 2 months time. You will see the changes, and that would be the maximum change which you are going to see. Don't fall prey to such things where people say you take sessions, 5 sessions, 6 sessions, 10 sessions of PRP. That's all gimmick. You will not see a single change with repeated session. I can guarantee you that. Okay, but nobody will talk about this. Nobody. You are lucky if you are watching me, and if you are watching me for the first time, you have just hit the jackpot. Art is surgery and artist is surgeon like you, sir. So thanks a lot. We'll have meet very soon. Thank you, Shibanshu. Um, Akshay Amte, आप see another important thing. We have to see आपका डोनर कैसा है. आपका डोनर देख के डिसाइड होता है, आपके नंबर ऑफ ग्राफ्स देख के डिसाइड होता है FUT या FUE. हमारे पास पेशेंट्स आते हैं, हम अगर ऑनलाइन हम उनका असेसमेंट किया भी है, सो भी समटाइम्स वी कैन नॉट बी रियली श्योर अबाउट डोनर कि कितना डोनर आपका किस सिचुएशन में है. सो वी गिव ऑप्शन. सो सी दैट इज द एडवांटेज ऑफ चूजिंग अ कंप्लीट क्लिनिक कि आपके लिए क्या अच्छा है वो आपके लिए किया जाएगा, ना कि भाई मेरे पास सब तैयार है, आप ये एक्स पेशेंट मेरे पास आया, ये वाई पेशेंट मेरे पास आया, ये सी पेशेंट मेरे पास आया, मेरे पास तैयार है फॉर्मूला. क्या मैं FUE करूंगा हर पेशेंट के अंदर, मैं कोई भी नाम दे सकता हूँ उसको. मैं PRP करूंगा, 4-5 PRP करूंगा, मैं हर पेशेंट को 1 mg फिनेस्ट्राइड खिलाऊंगा, ये मेरा फॉर्मूला तय है. तो यहाँ तो ये चीज़ तो नहीं चलेगी ना. नॉट वन नॉट आई मीन नॉट वन शू साइज फिट ऑल एवरीवन, यू नो. ये तो कस्टमाइज करना पड़ता है. तो कभी कभी ये भी होता है, हमारे पास पेशेंट बाहर से आ रहे हैं, हम लोग उनको ऑन द डे ऑफ सर्जरी ओनली भी डिसाइड किया यार हमें FUT करना है या FUE करना है. एंड्रोजेनिक एलोपेशिया, PRP is a good option. You can talk about PRP. Today's topic is not PRP. So talking about money, but to be honest, going too much costlier. Definitely, if you talk good and counsel good. See, Ajit, costing को लेके there are so many issues. People say कि cost है, ज़्यादा है, कम है. First of all, when you are getting your surgeries done, you don't even know the result which you are seeing, which you are watching, which you are happy about. People are giving testimonials. फिनेस्टाइड खा खा के टेस्टिमोनियल्स दे रहे हैं. उनको ये पता भी नहीं है कि जब फिनेस्टाइड छोड़ेंगे तो उनके साथ क्या होगा. उन्हें नहीं पता, बिकॉज यू आर इनोसेंट. आपको नहीं पता कि ये जो रिजल्ट आपको 4,000 4,500 ग्राफ बताए गए हैं, ये किए भी जा रहे हैं. आप कंसिस्टेंटली रिजल्ट्स उठा के देखें, गैलरीज उठा के देखें, आप पाएंगे बहुत सारे. देर आर सो मेनी पेशेंट्स वेयर यू वोंट फाइंड एनी जस्टिफिकेशन. हम जो रिजल्ट 2,500 ग्राफ्ट में दे रहे हैं, वो भी बिना फिनेस्ट्राइड के, वो वहाँ पे 4,000 ग्राफ्ट में, 4,500 ग्राफ्ट में आप फिनेस्ट्राइड के साथ ले रहे हैं बाकी जंगे. सो कॉस्ट, सी, मनी कैन नॉट बाय यू डोनर. वंस यू वेस्ट योर डोनर, यू आर गॉन. आपका कुछ नहीं हो सकता अगर आपका डोनर खराब हो गया है. सो आप कम ट्रांसप्लांट कराएं, थोड़ा कराएं. आप जल्दबाजी में भी ना कराएं. आप एट टाइम्स पीपल गेट लो हेयर लाइंस एंड देन दे रिपेंट फॉर द रेस्ट ऑफ देयर लाइफ कि ये गलत हो गया. सो इट इज अबाउट ऑनेस्टी, इट इज अबाउट skills, it is about concerns which we have for you. Okay, so money is a totally different ball game altogether. We'll have a separate discussion once I'll take a YouTube session on money aspects. We'll talk about that. Okay, paying more money does not mean that you are getting good results. You still, your results might be standing on finasteride, and you might be paying a lot, but you don't even know कि वो आपका जो रिजल्ट है वो तो फेक रिजल्ट है. Okay, so then Abhinandan, oh, thank you for this. I really like this. मुझे बड़ा अच्छा लगता है. And post transplant, I have freedom, liberty. And when I see, I've been doing transplants for 20 years. But जब मुझे अपना transplant करके hair style मिला, I am really enjoying it. I can feel the happiness which patients get after getting a good transplant. Yeah. प्रशांत, यू कैन कॉन्टेक्ट द टीम. माइक्रो नीडलिंग के बारे में बताएं एचटी के बाद. हाँ, माइक्रो नीडलिंग कैन बी डन केतन, बट नॉट इमीडिएटली आफ्टर ट्रांसप्लांट. आई थिंक one should wait for at least 4 5 months, 5 months before doing this after transplant. Finasteride, long-term disadvantage. We have discussed about this, Omkar, a lot. Can we combine two brands of? Why do you need to combine two brands of minoxidil? There is no need. You answered my query about Johnson & Johnson, which shampoo you made, please. You can, Khurshid, please contact the team at the given number. Again, I'm repeating, the number is 9999570494. And please do visit the website hairtransplantindia.co.in. Within a week's time, you will see our gallery where you will see a lot of things. And I don't think there is anything beyond that gallery. Once you see that, it will take some time. Anything beyond this, no doubt, nothing. You will get all the answers, everything in one go. You won't even need to ask me. I have opened my heart out there. Everything, you know, what I need to tell you, I have written. Okay, so I'll just run through this because we are running short of time now. Suyash Verma, side effects, finasteride, good candidate. Yeah, a lot of people who see. Now this is a common perception. I don't know why, but this is a common perception that if I am going for transplant, I have to take finasteride. Are you taking finasteride for yourself, or are you taking finasteride for the clinic, for the patient, because the clinic, for the clinic, for the doctor, because the clinic or the doctor wants to show result? Okay, see how this hair growth looks like. And see, you are not a trophy. Come on, man, come on. Mini check is a no, it does not cause any side effect on mind, I guess. I mean, it does not. I have here fair all cover, two spots, a good donor area. Nutcracker will have to, consider your case, and you can send your pictures and all. 29 years though is a good age. I mean, yeah, right age. See, 23, I have done transplants in even younger patients, but then patient has to understand that we cannot give him a glow hairline. Where it depends whether we are doing it here or we are doing it here in the crown. A lot of factors have to be considered. There is no hard and fast rule for everyone. So that is the reason why I'm telling again and again, please don't, uh, please use your brain. You are an individual. If a clinic or a doctor does not respect your individuality, don't go there, because you are just a number for them. Okay, the number X comes. Okay, okay, take this treatment. Number Y comes, take this treatment. Number C comes, take this treatment. So पहले से ही सब तैयार है. Sir, I had HT 6 months back. From last few days, I'm losing hair. Still, I'm on finasteride now. So a lot of people do this. They are on finasteride, and see, finasteride also does not work in all. So it's a very sensitive issue. Finasteride. We'll talk about this, and please go through the videos. You will find a lot of stuff. And very soon I'm going to post some more videos with more examples, more case studies. Stay tuned. Those who haven't subscribed, please subscribe. मिस्टर कूल सर, मैं पिछले 5 साल से फेल्ड हेयर ट्रांसप्लांट लेकर घूम रहा हूँ, यहाँ आपकी क्लिनिक में कांटेक्ट किया था, पैसे अरेंज नहीं हुए. देखो मिस्टर कूल, आई नो यू. मैंने आई रीड ऑल द कमेंट्स, आई डू अ लॉट ऑफ, बिकॉज ऑल ऑफ यू मीन अ लॉट टू मी. आप बहुत सारे रिसर्च कर रहे हैं, ये भी मुझे मालूम है. आपने एक एफ यू ट्रांसप्लांट कराया है पहले, ये भी मुझे मालूम है. और अब आप एक और अगर एफ यू ट्रांसप्लांट प्रिपेयर के लिए जाते हैं, तो दिस वुड बी द बिगेस्ट मिस्टेक ऑफ योर लाइफ. ओके, सो डोंट I am again telling you, don't fall prey to marketing gimmicks. Marketing different तरीके से होता है, एक पेशेंट का कंसर्न एक डिफरेंट तरीके से होता है. तो मार्केटिंग तो कोई भी कुछ भी करके इनकम्प्लीट क्लिनिक्स, इनकम्प्लीट सर्जन्स को चूज करेंगे तो प्रॉब्लम में रहेंगे. आप कांटेक्ट करें मिस्टर कूल, मेरी टीम से देखते हैं क्या किया जा सकता है आपके लिए. Shreyas, any clinics in Bangalore? Shreyas, all the clinics which are near your city or near your place may not be good, and a good clinic may not be near your place. So, if I have to open branches there, I need somebody of the same level of integrity, qualification, experience, skill, and intent. And especially, I'm talking about integrity. Okay, same level of honesty, which I have. Because Satya means honesty, Satya means truth. If I hire somebody, train somebody, but the integrity levels are not there, how can I leave you to them? How can I give the responsibility of your head to them? So one has to think about all these things. It is good, it is comfortable, convenient when you have clinics in your multi-center, multi-branches, and all that stuff. But I think hair transplant is a good, important decision of your life. You have limited donor, limited options. So once if you have to travel, I don't think that's a big deal. Online, you can consult people who are outside. They can consult us on online. We can do your assessment. We can give you a tentative plan, and then you can come over. We can plan everything in advance, and we can do the surgery. Then you don't have to come again and again, again and again. Thank you. So here I would like to end the session. रोहित, आप टीम को कांटेक्ट करें. एंड थैंक यू सो मच सुनील, आई वाज एक्चुअली लुकिंग फॉर दिस कमेंट. Thank you so much, sir. It's a wonderful information to share us, and thank you from my side also. And that's called gratitude. That comment actually made my day, and I am so happy. Thank you, and thank you so much. Please take care, and yeah, God bless. Thank you.